Hello everyone, a warm welcome and thank you for joining us. Now, tomorrow, April 25, is World Malaria Day, an international observance commemorated every year and that recognizes global efforts to control malaria. This year, though, the coronavirus pandemic is overshadowing the commemoration. And now the World Health Organization, WHO, has warned that the number of deaths caused by malaria in sub-Saharan Africa could double as efforts to tackle the disease face disruptions. As of Thursday, April 23, Africa had registered more than 26,000 cases of COVID-19. Some 7,000 people have so far recovered, while almost 1,250 people have died. At a media briefing, WHO Regional Director for Africa, Matshidiso Moeti, urged all countries to ensure that essential malaria prevention work continues during the coronavirus pandemic. Now, how feasible is this, going by all of the restrictions put in place to fight COVID-19? For more on this, we're being joined by Olivia Ungu from the Civil Society for Malaria Elimination based in Cameroon. Olivia, a warm welcome to you. Thank you for joining us. So, for several weeks, Olivia, COVID-19 has been keeping everyone in line, but indeed, there are other issues on health in the world. Globally, 3.3 billion people in 106 countries are at risk of malaria. How can we lead the fight or the advocacy against malaria during this coronavirus time?
Right now, all the attention of leaders, communities, and the media is focused on COVID-19. Well, it is important because it is a pandemic which is wreaking havoc, causing great damage. So it is important for people to know they have to protect themselves from this virus. But unfortunately, at the same time, we know that mosquitoes will not wait for the COVID-19 to pass, to bite and attack our populations. So if we, at the same time, carry out strong actions to block the voice to COVID-19, it would be necessary that the malaria prevention and treatment interventions are implemented as well, because we know that malaria, especially at this time of a pandemic, has the capacity to resurface and do a lot of damage. So it should not be forgotten. We should not forget that it is important to prevent and have access to effective treatment in time against malaria.
And indeed important not to forget, particularly as tomorrow is World Malaria Day. Now, I've read some reports about the symptoms of coronavirus and malaria, the two diseases being similar at times. Do you think that this coincidence might have an impact? I mean, simple bouts of malaria may likely become severe because people are afraid to go to the hospital. What do you think, Olivia?
Indeed, it is one of our greatest fears because malaria and COVID-19 have almost the same symptoms. One of the main symptoms is the onset of fever, and we therefore fear that people with episodes of fever may decide to, stay at home or to self-medicate, when it is absolutely necessary to kill the parasite that gives malaria. Because we can go from a state of simple malaria to a state of severe malaria, and that can develop in less than 48 hours. So any fever or malaria that is not treated becomes extremely dangerous. It would be necessary for populations to go to the health center to do a diagnostic test fast at the appearance of the signs of fever, and the staff will be able to assess after the test if it is malaria or COVID. All of this is already creating psychosis. We have observed that people no longer go to health centers for simple consultations in case of fever, and that's because they are afraid of contracting COVID-19.
Olivia, what are the other risks that the current health crisis could have on the activities of prevention, sensitization, research, etc. in this field?
Absolutely. We are even already seeing an impact of COVID-19 on malaria control activities in particular. And there are several countries which had to plan campaigns for free distribution of long-lasting treated mosquito nets. But unfortunately, these mosquito nets distribution campaigns currently cannot be carried out. Certain populations, especially the most vulnerable, cannot have access to these nets. So during the period of high transmission, which goes from July to October, there is a very effective campaign which is made for children of less than 5 years and which makes it possible to distribute to them preventive medication to fight against malaria. That is called the campaign, the chemotherapy prevention of seasonal malaria campaign. And we are worried because these campaigns should take place. As we said, the rainy season will not wait. Mosquitoes will not wait during the period of lockdown. It may be difficult. It is hoped that the situation will return to normal as soon as possible. And finally, the health personnel are highly mobilized for COVID-19, which takes all the attention. And it should also be noted that in certain health centers, certain people are placed in quarantine because they are exposed and contaminated. So imagine us in our context in Africa, where we do not already have sufficient health personnel. If some of this personnel is put in quarantine or cannot properly exercise their duties, it would absolutely create a huge gap in the management of malaria on the continent.
Ça va créer un gap. En fait, c'est même déjà en train de créer un gap dans la prise en charge même du paludisme.
And surely that needs to be looked into. Interesting and thought-provoking there. Thank you very much, Olivia. This is how much we can take this morning. I'd like to thank you very much for your insight. Thank you.